By this time, you have already learned about the function and parts of the respiratory system. You have discovered how important it is to your life. The respiratory system is vulnerable because it allows air into its passages. When air enters the passages of the respiratory system, it brings with it things that might cause more harm than good. Would you like to stay in a hospital? What are the fun things that you would miss if you got sick? The respiratory system's work is very important. The disorders of the respiratory system are usually manifested as coughing or difficulty in breathing. What you are going to watch are some of the conditions and symptoms of the diseases of the respiratory system. Bacteria that cause pneumonia are present even in the healthy throats. When the body's defenses are weakened, the bacteria multiply and cause damage. A person who has pneumonia usually has a fever and cough and has difficulty breathing. The difficulty in breathing is caused by the excessive mucus secretion that prevents gas exchange. This sensitiveness of the air passages serves to protect the respiratory system. However, some people's respiratory system are much too sensitive that they often suffer allergic reaction manifested as wheezing and difficulty in breathing. Asthma has still no cure. Drugs are either inhaled or taken to relax the hyperreactive airways. But these are just temporary measures. Asthma attacks usually occur again after a while. Alveoli are small, thin-walled fragile air sacs located in clusters at the end of the bronchial tubes deep inside the lungs. There are about 300 million alveoli in normal lungs. Emphysema is one of the most preventable respiratory illnesses because it is strongly linked to smoking. Symptoms may include coughing, wheezing, shortness of breath, chest tightness, and an increased production of mucus. Air pollutants, an alpha-1 antitrypsin deficiency, and respiratory infections can also play a role, but smoking is considered the number one cause. Lung cancer typically doesn't cause signs and symptoms of its earliest stages. Signs and symptoms of lung cancer typically occur when the disease is advanced. Signs and symptoms of lung cancer may include a new cough that doesn't go away, coughing up blood even a small amount, shortness of breath, chest pain, hoarseness, losing weight without trying, bone pain, and headache. Smoking destroys the respiratory system since harmful substances like tar and nicotine from cigarettes are deposited in the lungs. This affects the natural capacity of the lung to rid themselves of waste materials. Hence, more of this waste accumulate. When the damage from chemicals become too much, the bronchial cells become malignant. This causes lung cancer, a fatal condition. Like asthma, rhinitis is an allergic reaction to dust and pollutants. This allergic reaction causes the mucous membranes of the nose to secrete too much fluid. Allergic rhinitis is very difficult to treat because it is a recurring condition. The best way to control is to avoid the substances that can cause allergic reactions. Pulmonary tuberculosis, or what is known as PTV, is common infection of the lungs that occur especially among people living in developing countries. It is caused by bacteria called Mycobacterium tuberculosis, which are transmitted between persons in crowded places. The bacteria stays inside the lungs and are very hard to eliminate. These are the symptoms: coughing for 3 or more weeks, coughing up blood or mucus, chest pain, weight loss, fatigue, fever, night sweats, and chills. However, an anti-TB drug regimen is already available, which the patients usually have to take for months. If left untreated, TB can destroy the lungs and spread to other parts of the body, such as the bones and intestines. I hope you learned something from this video. Click like and share, and don't forget to subscribe to my YouTube channel. Thank you for watching.